Well, now to the latest on a big developing stories. The Spurs are without Wemby, taking on the Suns in their first game without the star. Word coming out just before this game that Victor Wembanyama would be out for the rest of the regular season. Now, key players stepping up last night after hearing that tough news, and Spurs win 120-109. So they're now looking at 29 more games without Wemby, who is out because of what's called deep vein thrombosis in his right shoulder. And this morning, Dr. Greg Guzley, who's a retired hematologist, joining us now with better perspective on his condition. So deep vein thrombosis, it's essentially a blood clot, right? So how can this happen?
Three different things that sort of trigger blood clots that you look for. Anything that might have damaged the vein. So in Victor's case, trauma, lifting, stretching, reaching, anything that causes the blood flow to be changed. And there are some cases where people are born with a genetic marker that increases the risk of blood clot. There are some medicines, birth control pills in women is probably the best example of medicines that can do it. So those are the three sort of general categories you look at. Did something damage the vein? Did something cause the blood flow pattern to change? Is he on any kind of medication, or is there any other like family history to suggest that there's a genetic component?
And of course, you know, he's incredibly healthy. He's young, but obviously incredibly tall as well. Does his height have anything to do with this?
I don't know the answer to that, and it's an interesting question. I would think that with all the physicals he's had, if there were anything related to his height that was causing his anatomy to be different, it would have been identified. I just don't know.
So we have not heard anything that he's going to undergo surgery. How is this typically treated?
Typically, this is treated with blood thinners to try to allow the clot to dissolve on its own. There are a couple of cases where you may have to go in and try to remove the clot, but those are pretty rare, and usually it's only if circulation has been damaged somewhere else. So like if a blood clot's in the arm, if his hand started turning blue, if he started getting numb or tingly, if there was evidence that he was just not getting good circulation, they might have to do that. But if the circulation is good, the hand is warm, everything is functioning the way it's supposed to, you use the blood thinners and try to avoid any kind of surgical instrumentation.
So the Spurs, they've said that his long-term prognosis is fine. Of course, you don't know the specifics, but what could maybe make them say that?
Well, when you've got a blood clot and this was identified quickly, you can treat it, it goes away, and patient's back to normal after a few months of therapy with the blood thinner. During the time he's on the blood thinner, clearly he can't play basketball. But in terms of normal day-to-day activity, fine. And once he's off the blood thinners, going back to his regular occupation shouldn't be a problem.
All right, well, that part is definitely good to hear. But Dr. Greg Guzley, 45 years as a hematologist, thank you so much for coming in today and giving us that perspective. I'll head back to Andrew.